My question is to the Prime Minister. I refer to reports the Secretary of the Department of Health wrote to intensive care doctors on Friday, asking them whether they think the health system can deal with an influx of COVID patients. 18 months into the pandemic, why has the Morrison-Joyce government waited until now to check whether the hospital system is coping?
The Prime Minister.
Mr Speaker, the assertion put forward by the questioner is completely false. It is just completely false, Mr Speaker. If the Labor Party cared to pay any attention to what was going on, they would know that for months and months and months, Mr Speaker, the Secretary of the Department of Health has been providing regular updates to the Premiers, the Chief Ministers and myself, upgrading the views about the status of the public hospital system and the public health system and their response capacity to the COVID-19 pandemic. That has been happening since the outbreak of the pandemic. And to suggest otherwise, Mr Speaker, is just a deliberate attempt by the Labor Party to undermine public confidence in the COVID response. Mr Speaker, that is becoming a very regular theme from the Labor Party, to undermine the response. They're for and against JobKeeper, Mr Speaker. They undermine the economic measures. They undermine the serious investment made by the Commonwealth, some $6 billion to support public hospitals, Mr Speaker. $6 billion.
The Manager of Opposition Business on a point of order.
Yeah, Mr Speaker, there have been many questions today that have asked about alternative policies, but this is not one of them, on direct relevance.
Yeah, I'm listening to the Prime Minister. The question was specific. He certainly addressed it, and I have, as I often do, allowed a little bit of latitude for some context, and I think the Prime Minister's probably done that. The Prime Minister.
Since the beginning of this pandemic, we've been working with the states and territories to bolster the ICU capacity, the flexibility within our hospital system, the ability to move staff and resources around the country to respond to the needs that may present, Mr Speaker, and indeed may well present in the future. Because what we know about COVID is very uncertain. There are new strains and we need to be prepared to respond, and that is exactly what's occurring, Mr Speaker. And the Secretary of the Department of Health has been tasked again to do even further work on that, because that is part of the national plan. The national plan seeks to put in place vaccinations at 70% and 80% to the move to the next steps, and that is supported by a number of other important measures. There's the testing, the tracing, the isolation and the quarantine. And as we move into Phase B and Phase C, home quarantine will be very important, because home quarantine is what allows Australians to travel again and return and get more Australians home. And the way TTIQ works in Phase B and Phase C is what is being worked on together. In addition, Mr Speaker, there is the public health social measures that need to be kept in place at low levels to support the higher levels of vaccination to ensure that Australians can live with this virus. And there is also the essential support that is necessary to bolster our public health system. Mr Speaker, and our government, we have continued to increase our investment in public hospitals, not just when we hit the pandemic, Mr Speaker, but over our entire term of government. Indeed, in Western Australia, the rate of increase of our investment in public hospitals in Western Australia has been 4 times that of what has occurred at a state level in Western Australia, Mr Speaker, and we will continue to do that under our hospitals agreement. But in particular during this pandemic, our 50-50 agreement with the states and territories has seen us already invest $6 billion supporting states and territories with their public health systems. Mr Speaker, I would encourage the Labor Party to stop being so negative, to support the national plan.
Concluded.